So if I would take the moderator's prerogative, I'm going to thank this panel, and I'm going to next introduce our colleagues from the American Cancer Society. We have both Myrnelle Gomez and Stephanie Vilchis who are here. The American Cancer Society, as we think about resources and partnership, really is a good back-to-back conversation with this panel, because this is an organization that has been working for a long time on all of the different types of cancers, and in our gynecologic cancer space, they have been most helpful. And I think knowing what resources are available are important to this audience. So we will continue with talking about ACS, and then we'll give a little bit more speech to about how you guys can give back. So Myrnelle and Stephanie, I give it to you. Thank you.
Hi, thank you, Dr. Chen. Can you hear me okay?
Yes, we can.
Great. And are you able to see my slides here?
Yes, we do.
Perfect. Thank you. Well, this is Stephanie. Myrnelle actually had to jump off the call, so it'll just be me. But just hello to everyone on the call today. I'm delighted to provide a quick presentation on American Cancer Society programs, services, and support resources for you all. I will try to move quickly so we can get to the agenda and hopefully answer some questions for you all at the end. Let's see here. There we go. First, I just want to start by briefly introducing myself. As I said, my name is Stephanie Vilchis, and I'm an Associate Director of Cancer Center Partnerships for the American Cancer Society. I live in Los Angeles, California, and have been working with ACS for over 15 years, serving in many different capacities. In my presentation today, I just want to discuss how you can obtain cancer information and get connected to online American Cancer Society resources. I'll share information about our transportation and lodging assistance programs, provide information on our navigation support program, ACS Cares. I'll discuss some of our survivorship and cancer screening resources, share information about our advocacy organization, ACS CAN, and most importantly, I'll go over how you can get connected to all of our programs and services. But before we dive in, for those on the call who may not be familiar, the American Cancer Society is a nationwide organization that's dedicated to eliminating cancer as a major health problem. Our organization exists because the cancer burden is unacceptably high. So our mission at ACS is to improve the lives of people with cancer and their families through advocacy, research, and patient support to ensure that everyone has an opportunity to prevent, detect, treat, and survive cancer. And the way that we fulfill our mission is through our three pillars that you see here. First, through discovery. ACS is the largest funder of cancer research outside the U.S. government, supporting the best and brightest cancer researchers across the nation. Our second pillar, advocacy, is essential to increasing access to cancer breakthroughs by supporting policies and legislations that help cancer patients. And our third pillar is patient support, which is what I'm mostly here to talk about with you all today. And through this pillar, we touch more than 79 million lives per year in communities across the country and across the entire cancer continuum. We do this by providing education, by providing free services like transportation and lodging, by providing patient navigation support, and through our critical work on prevention and early detection efforts. So let's start with how you can obtain cancer information and discuss some of our online resources. First, I want to share information about our National Cancer Information Center, which is composed of our cancer helpline or 800 number and our website, cancer.org. On the slide, I've listed some of the ways that we assist through these two resources. We can provide general cancer site information on prevention and screening, detection and diagnostic procedures, treatment options, connect people to ACS programs, and provide community and nationwide resources. I do want to take a little bit of a deeper dive into each, so we'll start with our cancer helpline or 800 number as we tend to refer to it. As you can see, there are a lot of support options our 800 number has to offer. Our cancer helpline is available 24 hours a day, 7 days a week, 365 days a year. It's available in over 150 languages and has capabilities for the hearing impaired. And as listed here through our helpline, we can provide the latest science-based information on cancer, connect patients to ACS programs, provide nationwide and community resource referrals. And a lesser known fact about our helpline is that we also have oncology nurses on staff to assist patients with understanding complicated medical information and answering any medical questions they may have. Next is our website. Cancer.org is one of the most trusted sources for research-based cancer information that is out there. As you can see, our website has many features that is similar to our 800 number, but in addition, as a result of the pandemic, we added a video live chat option for people to get connected with a live person anytime they need through our website as well. We also have additional online resources like our health insurance assistance service that helps with health insurance questions and concerns. We have our online personal health manager, which is a set of materials to help people stay organized during and post-treatment. We have our Reach to Recovery program that provides breast cancer patients one-on-one support from breast cancer survivors. And then we also have a new screening locator tool to help people find cancer screening locations in their community. And for appearance-related side effects of treatment, we have the EverYou program. EverYou is our rebranded TLC catalog that will continue to support individuals through their cancer journey with a curated selection of high-quality wigs, headwear, and post-surgical products to keep people feeling like themselves during and after treatment. More information about EverYou is available directly on the program's website, everyou.com, and the new rebranded catalog will begin distribution to those who are on the mailing list beginning this month. If you'd like to receive the catalog, you can visit the program's website or you can visit cancer.org to sign up to receive these. And now moving on to our transportation and lodging programs. I'll start with transportation. Road to Recovery is a program that you may be familiar with. This is our volunteer transportation assistance program, where trained ACS volunteer drivers provide free rides to treatment and cancer-related medical appointments. Anyone with a cancer diagnosis in need of transportation can contact ACS by calling our 800 number to request assistance. This program is available in most counties across California, and you can get more information if you call our helpline or if you visit cancer.org to sign up for the service. For lodging assistance, we have our Keys of Hope program through our partnership with Extended Stay America Hotels. Through this program, we can provide free and reduced cost rooms if you live more than 40 miles away or more than 1 hour away from your treatment facility. To request assistance, we just ask that you also call our 800 number, and our cancer information specialist will assess eligibility, then provide detailed instructions on how to book the lodging. This program is available at over 760 Extended Stay America locations across the United States. And now I'd like to share about a program that was recently launched, the ACS CARES, or Community Access to Resources, Education, and Support Program. ACS CARES is part of our Patient Navigation Initiative. It's a digital navigation support program designed to provide personalized, non-clinical patient navigation support to those affected by cancer directly on their phones. The program utilizes a social determinants of health assessment to provide tailored navigation support with curated information and tailored resources. Patients who are enrolled in ACS CARES will also have 24/7 access to support from our staff who can connect people to ACS programs as well as provide national and local resources. ACS CARES is available in Spanish, and the QR code on the screen here can take you directly to the program's landing page to learn more or to get started with the program. And now I'd like to provide some information on our survivorship resources. First, we have the National Cancer Survivors Resource Center, which has developed tools and resources to ensure that survivors have the support they need as they transition out of active treatment. We also have Cancer Survivors Network, which is an online peer support community and a great way to connect and get support from others who have gone through or are going through similar journeys. We also have lots of educational resources on our website survivorship page. I've listed some of the resources here, like our Cancer Survivors video series, which is a series of videos on how to cope with the physical and emotional challenges of cancer survivorship. We have information on living well and being healthy after treatment, managing cancer as a chronic illness, and of course, understanding recurrence. All these resources are available through our survivorship landing page on our website, cancer.org. And now I'd like to discuss some of the resources that we have available related to early detection and cancer screening. Because whether or not someone has already had cancer, continuing to screen for other cancers is still very important. So I'd like to share just a few resources that we have available for early detection. ACS has developed lots of tools to help people access cancer screenings directly on our website. ACS has recently partnered with the NFL's Crucial Catch initiative to develop the Defender 2.0 tool, which helps people access cancer screening information and find screening centers in their community with just the click of a button. There's also a quiz to help people identify appropriate screenings, which includes lifestyle questions for overall cancer risk, and also has an automated screening reminder function that you can sign up for. And as I mentioned before, we have a screening locator tool with over 22,000 screening locations across the US. You can get more information on our Get Screened landing page at cancer.org/getscreened to learn more about important early detection resources that are available. And now I'd like to just quickly share a little bit about our work in the advocacy and legislative space through our affiliate nonpartisan advocacy organization, ACS Cancer Action Network, or ACS CAN for short. And as I mentioned at the beginning of my presentation, advocacy is really essential to increasing access to cancer breakthroughs by supporting policies and legislations that help cancer patients. ACS CAN fights cancer in city halls, state houses, and Congress by elevating the patient voice to advance policy change. On the slide is information on a very important bill that ACS CAN is supporting in California, Senate Bill 1213. In 2024, more than 34,000 Californians will be diagnosed with breast or cervical cancer. Screening leads to early detection and early treatment of cancer, which ultimately saves lives. Senate Bill 1213 will increase eligibility for the Every Woman Counts and the Breast and Cervical Cancer Treatment Program to close the gap on cancer care for Californians who do not have access to affordable healthcare options. This bill has passed the legislature and it's on its way to the governor for signature. With this bill, it is estimated that around 2,100 more women will be covered for important screenings and care. You can visit ACS CAN's website at fightcancer.org to sign the petition to help us generate awareness and support this important bill, as well as learn more about the state and federal priorities that you can help support through ACS CAN. And now to talk about a very important piece, how to get connected to all the resources that I just discussed. So as you can probably see by now, getting connected to ACS is easy. The quickest way to access our information, programs, and resources is by calling our 800 number directly. Our National Cancer Information Center is available 24 hours a day, 7 days a week, and you will always get a live person to talk to when you call. Next, it is by visiting our website, cancer.org. A great key feature of cancer.org is that you can connect to a live cancer information specialist from the live chat option at any time that you need as well. And another great way to connect to ACS is through our ACS Cares patient navigation program, where you can download the ACS Cares app to get tailored cancer information, resources, and get connected to all of our programs. And finally, as I end today, I want to just provide a quick recap of everything that I discussed. So if you can take away one thing from my presentation is to please tell anyone that you know who is touched by cancer about all the support services that ACS has to offer. Listed here are some of the main resources that I'd like for you to take away from my presentation, as well as how anyone can access all of our services either by phone through our 800 number, through our website, cancer.org, and by downloading our ACS Cares app for support. And last but not least, you can always stay connected with ACS through our social media channels. And that is all I have for today. Thank you once again for joining us today. Thank you to Dr. Chen and UCSF Health for having me. I'll take any questions if there's any in the chat, but have a great rest of your day. Thank you.